will you look at Karen Smith's gym clothes?
Of course, all the plastics are in the same gym class. Where are the plastics?
They're teen royalty. If North Shore was Us Weekly, they would always be on the cover.
That one there, that's Karen Smith. She is one of the dumbest girls you will ever meet. Damien sat next to her in English last year.
She asked me how to spell orange.
That little one, that's Gretchen Wieners.
She's totally rich because her dad invented toaster strudel.
Gretchen Wieners knows everybody's business. She knows everything about everyone.
That's why her hair is so big. It's full of secrets.
Hey, what's happening?
And evil takes a human form in Regina George. Don't be fooled, because she may seem like your typical selfish, backstabbing, slut-faced hoe bag, but in reality, she is so much more than that.
She's the queen bee, the star. Those other two are just her little workers.
Regina George. How do I even begin to explain Regina George?
Hello everyone, welcome to our afternoon discussion. My name is Emily.
I'm Christine.
I'm Gabby. I'm Marcella.
And I'm Madison.
And today we will be discussing birth control.
Yay!
Killed it. Got it. 20
That's it.
takes. Wait, what else?
Hey friends, I know what you guys are thinking. Emily, out of all people, why are you talking about birth control?
Yeah, don't you have like 10 kids? And aren't you still breastfeeding 2 of them?
Yeah, what's your point? The reason I'm talking about birth control is to prevent you from ending up being like me. So today, we're gonna be discussing some very common forms of birth control. Come along with me.
What are the 5 most common forms of birth control?
I'm glad that you asked that. Today, we're going to be discussing some common forms of birth control. The pill, the implant, an IUD, abstinence, and condoms.
So what are you doing this weekend?
Oh, I think I'm gonna go out to a couple of bars.
Oh, how fun.
And I have a concert on Saturday.
Really?
Yes. What are you gonna do this weekend?
I'm gonna go to the lake
Oh, that's fun.
and just drink.
Oh, okay.
That's all
So,
day.
oh God, that noise. It's horrible. What is that?
I don't know.
Okay, I gotta take my birth control pills.
Yeah, just pop them all in. Every single one of them.
I don't know. Yep. Okay. Birth control pills. The pill is a popular oral contraceptive. Some of the reasons birth control is the most popular is they are highly effective and reversible. Birth control pills contain estrogen and progestin. For breastfeeding mothers, they can be offered the mini pill, which is progestin only contraceptive. Oral contraception should be taken at the same time every day, and if a dose is missed, it can be taken as soon as you remember. For example, a woman who has a 28-day pill pack will take each pill each day, and the last 7 days are inactive pills. But to help the woman keep in the habit of taking the pills each day, on the days the women are taking the inactive pills are the days she will have a menstrual cycle. Does that make sense?
Mm-hmm.
Why take the pill at the same time each day, you ask? This helps to maintain a stable blood level of hormones.
Great time.
Okay. Extended dose contraception is the same as monthly contraceptive, except that it is inducing amenorrhea. The women should take the active pill for 84 days and then take the inactive pills for 7 days, which results in a period once every 3 months. Can there be adverse effects, you ask? There has been no evidence to suggest that there are any adverse effects of extended dose regimen. In fact, it has been proven to minimize bloating, fluid retention, and symptoms of PMDD associated with taking oral contraceptives. Some side effects of contraception are nausea, headaches, breast tenderness, weight gain, spotting between periods, amenorrhea. These effects will usually lessen with time. Who should not take oral contraceptives? Women with blood clotting disorders, women with cancer, impaired liver function, smokers, possible pregnancy, and undiagnosed vaginal bleeding. Teach the patient that if they're taking antibiotics, anticonvulsants, rifampin, or barbiturates, that this could decrease effectiveness of oral contraceptives and that another barrier method should be used. Any adverse effects should be reported. Think of the acronym ACE: abdominal pain and fever, chest pain, dyspnea, and blood sputum, headaches, weakness, numbness of extremities, eye problems, blurring or double vision, and severe leg pain or swelling and speech disturbance.
Nexaplon. What is a Nexaplon? The Nexaplon is a birth control implant that goes in your arm. It can go either arm, and the effectiveness of it is 99%, well, up to 99%, and then you can have it up to 4 years. You can take it out before if you'd like, and then the doctor does have to insert that, and it can, a quick overview of the implant is it's a small implant rod inserted under the skin in the upper arm, so it goes like around here. And how it works, the implant releases progestin, a hormone that keeps ovaries from releasing eggs. Progestin also thickens the mucus inside the body to prevent sperm from releasing eggs. And it also contains progestin. Some side effects would be nausea, stomach pain, vomiting, weight gain, acne, and then the list can go on.
Today, we'll be talking about the intrauterine device, or IUD. What's an IUD? It's a small plastic T-shaped device that's placed in your uterus to prevent pregnancy. There are two types, hormonal and non-hormonal. They provide long-lasting, reliable protection against pregnancy and are easily reversible. Some pros about the hormonal IUD is that it can last from 3 to 7 years, and the non-hormonal IUD can last from 10 to 12 years. IUDs are over 99% effective. They're among the most effective birth control methods available, and they have no sex prep required. Many women experience lighter periods and in some cases stop bleeding altogether. Some cons are that they don't protect against STIs and the insertion can be painful. How it works. Each IUD works differently, but with the same outcome. It makes it difficult for the sperm to reach the egg. Hormonal IUDs contain the hormone progestin, which is similar to progesterone, a naturally occurring hormone in our body. Progestin works by thickening the cervical mucus to block sperm from entering the uterus and inhibits the sperm movement to make it harder to reach and fertilize an egg. It also thins the uterine lining, so an egg is less likely to implant in the uterus. Paragard, which is a non-hormonal IUD, also known as the copper IUD, is wrapped in coil. The copper ions released into uterus create an inhospitable environment to the sperm, which basically means that it leaves the sperm powerless, so it can't fertilize an egg and it can't get you pregnant. How quickly do IUDs start working? Depends on which type of IUD you get. Paragard can prevent pregnancy as soon as it's placed and is actually used as an emergency contraceptive. It's over 99.9% effective at preventing pregnancy if placed within 5 days after having unprotected sex. The hormonal IUD is only effective immediately if inserted within 7 days of your period. Backup birth control should be used if you are going to get the hormonal IUD inserted for the first month after placement. Cramping and backaches are common within the first hours to days after insertion. IUDs aren't recommended for people who have an STI or STD, have PID, may be pregnant, have a bleeding or clotting disorder, have history of breast cancer, are allergic to copper, or have Wilson's disease. Make sure to take a comfy blanket, a water bottle, comfy clothes, and take pen medications half an hour before your appointment.
Condoms are a barrier method of contraception. They are made of very thin latex, rubber, or polyurethane. There are both male and female condoms that can be used. A male condom is placed over the head of the penis down the shaft all the way down the base. A female condom is inserted into the vagina prior to sexual intercourse. Both are designed to help prevent pregnancy by stopping the sperm from meeting the egg. In fact, male condoms and female condoms are the only type of contraception that will protect you from both pregnancy and STIs only if used correctly every time. According to PlannedParenthood.org, Condoms are about 98% effective at preventing pregnancy if used perfectly every time. Now, we know that humans are far from perfect, so in reality that number drops to about 85% in preventing pregnancy. This means that about 15 out of every 100 people every year will get pregnant using only condoms as their birth control method. I'm now going to demonstrate how to use a male condom. First thing that you want to do is check the expiration date of the condom. So I have a condom here. Although condoms usually last about 3 to 5 years, it is important to ensure that the package is not expired for obvious reasons. It isn't uncommon for most men to have a big head up here, but a small one down there. So it's important to be honest with yourself in terms of what you're packing below, if you know what I mean. The condom package that you're using should be free of any air bubbles, rips, or tears. I'm going to be using my Dove deodorant spray to demonstrate how to properly place a condom on a penis. So, after opening your package and ensuring that there's no rips or tears or air bubbles and making sure that it's not expired, you're going to take your condom and see how there's like a little hat right here. That's going to be placed directly over the tip of the penis. So we're just going to pretend like this is the tip of the penis right here. The condom should unroll easily down the shaft of the penis. So if you're having a difficult time, this may be because the condom is inside out or simply not the right size. The condom should roll all the way down the shaft of the penis, right down to the base right here. Now, I know at this point that things may be getting a little bit hot and heavy, but you're going to want to double check that your condom is free of any tears one more time. After placing the condom on the penis, you're going to want to pinch the top right here, making sure that there's a little bit of space left over for any sperm that can collect after having sex. So after a quick inspection, making sure that everything is good to go, it's time to put this condom to use and have some fun.
Don't have sex. Don't have sex in the missionary position. Don't have sex standing up. Just don't have sex, okay? Here, everybody take some rubbers. Abstinence is choosing to completely abstain from having sex. Abstinence is the most effective form of birth control. If two people don't have sex, sperm can't fertilize an egg and there's no possibility of pregnancy. Abstinence requires no barriers or pills to be needed, and abstinence is the only surefire way to prevent pregnancy and STDs.
Before kids, this was 1 week's worth of laundry. Now this is 2 days worth of laundry. It's just piles of nonstop laundry over here.
Before I had kids, I could buy whatever I want. Now, all my money's spent on stuffed animals, ninja swords, and clothes. Yeah.
Can we go to Target? And I can't even get a second to myself.